You're watching My Cayman Life TV. We are at the 11th Annual Cayman Heart Fund International Symposium, bringing together specialists from around the world with our medical personnel here in the Cayman Islands to share some best practices. I'm joined by Dr. Colombo. He's the Associate Medical Director at Jackson Memorial Hospital in Florida, and he's going to be talking about high blood pressure and hypertension management. Thanks so much for being with us.
Yeah, thank you for having me. I'm excited to be here.
So high blood pressure, hypertension, is that synonymous?
Yeah, high blood pressure is kind of a lay person way of saying hypertension. Hypertension is the medical term. There's actually categories of hypertension, and the new guidelines that came out from the American College of Cardiology actually kind of changed those categories. We actually have an elevated blood pressure category, which is in a territory that we didn't used to think of as being high blood pressure, where the blood pressure is between 120 and 129. They actually identified that group because they found that employing strategies towards lowering that blood pressure further may actually resolve problems down the line. Then there's stage 1 and stage 2 hypertension, which have a little bit higher cutoffs, and they made some recommendations about therapies for those.
Okay. In terms of risk factors, how much of it is lifestyle and how much of it is genetic?
It's probably a combination of both.
Okay.
It's environmental for sure, things that you're doing that are not great. Diet, high salt diet is often a culprit. Not watching the sodium content in your food is a big deal. Also, just having a sedentary lifestyle contributes. Patients who are obese have a higher incidence of developing hypertension. And actually, changing those can actually potentially reduce your risk of developing hypertension or even improving your blood pressure over time. Unfortunately, though, there is a component of blood pressure that just exists because either you're getting older or because it runs in the family. And you have to make do with what you can there and try to adjust the factors that you can adjust in your life.
Okay. Is it then, is that when you turn to medication to manage it, or does it depend?
So for all patients, definitely they should use lifestyle modifications, the diet, the exercise, not smoking, and watching what they're drinking in terms of alcohol. But also medications will play a part for certain patients, especially when the pressure runs on the high side. And they have other risk factors that can lead to other types of disease. So if they have diabetes, high blood pressure, or things that might lead to coronary heart disease or heart failure, we're going to try to be more aggressive with them, and the medication may help them at that point. Or if they come in with a very severely high blood pressure, dieting and exercise is not going to fix that by itself. You're going to need to take a medication.
So when you have high blood pressure, some of the things that you're more at risk for things like cardiac arrest, stroke. What else?
Yeah, so hypertension is super common, and unfortunately it leads to many types of cardiovascular diseases. The most common tend to be coronary heart disease. That's where the arteries of the heart become hardened and they cause blockages. That's where people get a heart attack, chest discomfort, and unfortunately they may die from that. They may also get stroke, which is it's almost like a brain attack where the vessels in the brain are not able to supply blood. And another common thing that can happen is heart failure, where actually the muscle of the heart gets weak and you're not able to pump blood to the organs as necessary. These three conditions are super common, unfortunately, because hypertension is so common and it's so poorly treated. And the new guidelines make a really big emphasis on trying to control the blood pressure more than we have, because we think that we can actually reduce the incidence of those common medical cardiac problems.
Because once you let it go too far and you have an incident like that, now you've got some permanent damage.
Yeah, unfortunately, once the damage is done, it's very hard to undo that damage. At that point, we're just trying to prevent the progression further. So the goal really is to try to even not get to that point and take medications or at least change your lifestyle to prevent that.
How often should people get their blood pressure checked?
So as a routine healthy adult, you should be seen by a doctor at least once or twice a year. That'll check your blood pressure. The reason why it's important is blood pressure that's on the high side is often asymptomatic. People don't realize they have high blood pressure. And the only time that they realize they have high blood pressure is having not gone to the doctor for years and showing up with a heart attack for the first time.
Okay.
So that's why screening, going to a doctor is super important. They say it's a silent killer, and it can be.
Right. I feel like, when you have kids, oh, they need to go to the pediatrician once a year. You have schedules to keep your kids on track with the regular checkups. And as adults, we kind of go like, we're fine. So it's really important not to skip that annual checkup with the doctor. I
agree. I think the annual checkup for adults is super important. And I can't tell you how many people I see that don't think about that. And even not just for blood pressure, but check your cholesterol, your sugar levels, things that you may not realize are slowly becoming a problem. And then will become a problem years later if you don't get it taken care of.
Okay, so advice going forward, get your annual checkup with your doctor, and also make those lifestyle modifications.
Absolutely,
get moving, watch what you're eating, right?
Exactly, so the exercise recommendation is 30 minutes 3 times a week, some sort of cardio activity. You know, whether it's walking briskly, running, jogging, elliptical. Try to find a little space out of your time to do that, because that will make a big difference. And dieting, of course, fresh fruits, vegetables, grains, avoiding the red meats. Those are
Avoiding the
really
red meats.
Yeah.
And
Or
avoiding
reducing it.
processed food too, right? Because
course,
when you
yeah.
talk about sodium,
Yeah,
you know,
anything
yeah.
processed, fast food, restaurants, they use a lot of sodium, and
Right.
it makes it taste better, but you have to find some other way, spices or some sort of flavoring that doesn't have sodium in it.
Okay, Dr. Colombo, great advice. Thanks so much for sharing with us
It's a
today.
real pleasure, thank you.
All right.
Thank you.
You're watching My Cayman Life TV at the 11th Annual Cayman Heart Fund International Symposium. I'm Vanessa Hansen.